Well, if Britain is to face years of flat growth, what lessons can we learn from Japan? Where have they suffered two so-called lost decades of growth? We'll be discussing that on Newsnight after 11. Has the government crossed the line of British decency with changes to the welfare system and planned cuts and payments to disabled young people? It's the accusation from Labour, but ministers say they'll press ahead with reform despite a legal challenge today and defeat last night in the Lords. Today, the Employment Minister, Chris Grayling, said tough decisions had to be taken to tackle the deficit. So right, in a moment we'll hear from him and a disability campaigner. But first, here's David Grossman.
Let's start where the government has, with the soaring cost of working age benefits, up 40% in real terms since 1997. And they are fiendishly complex. The DWP rulebook alone runs to 14 volumes, nearly 9,000 pages. And this is only part of the picture. Local authorities and HMRC also administer an overlapping and confusing system, all collecting similar data and dealing with many of the same people. Not surprisingly, perhaps, fraud and error costs an estimated £5.2 billion a year. And at the end of all this, well, 1/4 of working age adults are not in work. Often, the disincentives to taking a job are overwhelming. For 600,000 people, for every pound they'd earn from going out to work, 90p would be lost in tax or withdrawn benefits. It seems the first law of welfare spending is that unreformed, it will rise and rise.
If you look, it tends to be, certainly when I looked at it, I found that most of the growth was increasing numbers of people getting onto benefit. They may get onto benefit temporarily through a recession or something, and then they find they can live there on it and they don't come off. And the system didn't encourage them to come off and help them to come off. And the longer they remained on, the more demoralised, the less employable they became, and so they became sort of lifetime recipients of benefit.
So the government's plan is wholesale reform. Out will go income support, income-based job seekers allowance, income-related employment and support allowance, housing benefit, child tax credit and working tax credit, all to be replaced by one universal credit, and that will be capped at £26,000 a year max. The government's, though, having difficulty over changes that will come in before the universal credit arrives. At present, if you've made the right NI contributions, you can get employment support allowance for as long as you're out of work. The government wants to cap it at a year. Last night, ministers were defeated on this in the Lords.
It was a pretty big rebellion last night, actually. I know it was mainly crossbenchers. An awful lot of Liberal Democrats abstained. And I think we have to try and convince our party, even I don't expect to be able to convince the Conservatives, that we don't want to be a nasty party. We want to protect the poor and the disadvantaged and the sick. And I know it's trite saying that, but that's a basic principle we've always had in our party.
The government was actually defeated 3 times in the Lords. A Labour amendment raised the 1-year cap to 2 years.
Last night, they tried to cross a basic line of British decency by cutting back on benefits for patients recovering from cancer and for children with disabilities. So I'm glad they were defeated last night. We're writing to Chris Grayling and Ian Duncan-Smith today to say, look, these ideas were wrong. You need to take them off the table and bring back a welfare reform bill that is better.
But the government is trying to get its message across that this change would not affect the sickest recipients of benefits and only affect those with significant other income or savings.
The reason that this is being introduced is because of the economic climate. Nobody really wants to bring in these sorts of changes. But the Labour proposals would cost £1.6 billion, and that money would have to come from somewhere else in the benefits budget. And that means finding other people to take money away from. And they haven't made any suggestions where that money would come from. And I think that would be an extremely difficult choice to make.
Generations of politicians have had to grapple with essentially the same problem.
The Social Security Secretary patrols a £75 billion system, groaning with complexity and contradiction.
Peter Lilly knows what it's like to try to reform welfare, but he says it should be a vote winner.
When I wandered through the less salubrious parts of the country, people would see me and say, "You're Lilly, aren't you?" And then I'd say, "Yes," and I'd say, "Keep it up." But if I'm in the posher parts of the country in Hampstead, then sort of posh Hampstead ladies say, "I think you're very cruel and unthinking." But I had the mass of people on my side, and it was the only area of government policy where our popularity increased in the period 92 to 97.
Right. So you and your husband got an income of 13 grand.
But perhaps the biggest problem with welfare reform is rather well exemplified by this frankly baffling government advert for tax credits from 1999. The system is so bizarrely complex, hardly anyone really understands what's going on.
David Grossman. Well, joining me now, the Employment Minister, Chris Grayling, and the Disability Campaigner, Sue Marsh. Thanks for coming in, both of you. Let's start with Liam Byrne then, Chris Grayling. He accused you of crossing the line of decency. Is it more important for you to save money, even if you face that kind of accusation?
Well, I think he's just plain wrong, and I think that the Labour Party last week, Liam Byrne personally was talking about the need to take tough decisions on welfare. This week he's doing just the opposite. And let's be clear about what we're not doing. We are not taking away benefits from people who have no other income. We are not taking away benefits from people who are not going to be able to work again. We are making changes for people who've got another income or have got thousands of pounds of savings in the bank.
Sure.
So that's the principle of what we're doing.
And that was presumably understood pretty well by those in the Lords. Lord Patel, though, saying he is sympathetic to cutting the deficit, but highly sympathetic to something that will make the lives of weak and vulnerable people even more miserable. I mean, this is why it's being shouted down now.
Well, if you take the example of one of the amendments last night on young people, what we've got is a situation right now where if a young person reaches adult life and they have other financial means, they could receive, for example, a substantial inheritance, they're still able to unconditionally receive benefit support for an ongoing period. Now, if they're never going to be able to work, the situation won't change for them. But if they are in a position where, with the right help and through our work programme, we've put in place specialist support to help people who've got the potential to return to work to do so, then I don't think it's right that somebody who's got other financial means should depend on taxpayers who are on relatively low incomes themselves very often to pay the money to help people who've already got money themselves.
And Sue Marsh, what's so wrong with that?
What that amendment was actually about, we felt, was that children who were born profoundly disabled, who might not be able to work when they get older, should have an entitlement when they reach adulthood to an independent income. They shouldn't have to rely on parents or family to look after them. If you're born that profoundly disabled, you should have an income in your own right.
But for those children in a position where they'll never work, they'll be on unemployment support allowance in what's called the support group, which is something we've increased in size. We're providing more long-term unconditional support than the previous government. Then those people won't be in a different position. Their situation will remain unchanged.
I mean, it's very easy, isn't it, to demonise the government over such an emotive issue as this, when the government has clearly stated that for cases of long-term chronic illness, the support group will not change its benefit structure. This is only about people who presumably you would want to see getting back to work.
First of all, we don't think enough people are going into the support group. That's one of the big flaws with employment and support allowance. We don't feel that enough people with long-term conditions are getting that unconditional support.
So that's not about an actual an amendment to a reform?
No, the amendments to the reform yesterday, I mean, we were sitting there watching the debate, and one of the debates about was how terminally ill you have to be to qualify for benefits. You know, being terminally ill for 6 months, that was OK. You would get some unconditional support. If you were terminally ill for 3 years or 4 years, you weren't going to get that support. I find it shocking that I'm living in a country where I sit there and hear ministers or lords arguing over how terminally ill you have to be to get benefits.
If you didn't have the deficit problem, would you still want to bring about this kind of reform anyway?
We'd certainly still want to change the welfare state and make it much more relevant to our core objective, which is to help people back into work and disable people back into work, and it's a key goal. And the point about the support group, the long-term group who do receive unconditional support from the state, we've grown that in the past year. It's bigger than it was when we took office. We've introduced changes that are consciously intended to make sure we provide better support for people, for example, who've got long-term mental health problems. But yes, of course, we're having to take tough decisions because of the deficit. We've got to do that across a whole range of different areas. And yes, there are things we are having to do which we would rather not have to do, but we think we're trying, and we're certainly trying to get the balance right.
And it would be very easy, wouldn't it, to say once somebody has been classified as disabled or a chronic sufferer, they need never be assessed again. That might not be helping either the state or the individual.
That wasn't what the debate was about, though, yesterday. We weren't talking about assessments. One of the other votes that failed was for a 1-year time limit on employment support allowance. Not for the people who go into the unconditional group, but for the people who are judged to be unwell, unfit to work, but maybe can get back to work with the right support. Now, when ESA was originally designed, they thought that it would take between 2 and 5 years for those people with the right support, and that's the key thing, to get back into work.
I mean,
now, introducing a 1-year time limit means that someone like me who's been ill for 27 years, I am now going to be, after 1 year, if I don't go into that support group, entirely dependent on my husband, who doesn't earn very much, to survive.
But you heard there are increasing numbers of people on disability benefit now. They don't want to live on it. They want to come off it, presumably, and be back at work.
That's absolutely fantastic. No problem with that at all.
But do you see the problem
if
there is no kind of means assessment at all?
No one's calling for no assessment at all, I don't think. I don't think anybody's called for no assessment. I think we need a fair assessment. I think we need an assessment that looks at people's conditions individually. I don't think we can have a tick-box system of 15 questions where you sit in front of somebody and they just go through the questions and you have to fit this rigid system.
We've seen a lot of U-turns already from your government. Successive governments have tried and failed on welfare reform. You've already been defeated in the Lords. You've got legal challenges with the unemployment benefit cuts. You're starting to realise why nobody ever manages to do this.
We're going to do this. This is part of a transformation of our welfare state that is really necessary. In many of our communities, we've now got long-term endemic worklessness that has gone from generation to generation. We have an appallingly low level of people with disabilities in work. What we've done through our Revolutionary New Work programme, a payment by results basis, we've got organisations that are delivering personalised support to get people into work from long-term benefit dependency. They have the freedom to do what works, but we only pay them when they're successful, and that's a really big step forward.
And you sound very certain that you will pull this off. We've already heard David Cameron hint that child benefit might be re-looked at. His words were, we always said we'd look at the steepness of the curve, look at the way it's implemented. This was something that you introduced at the Tory conference before last. The Telegraph is leading on this rethink of child benefit cuts. That's going to change now, isn't it?
Well, I mean, first of all, in terms of our welfare reforms, there's no U-turn planned. I'm in the position where child benefit's done by the Treasury as part of the budget preparation, so I don't know what they're doing because I'm in a different department.
Would you be surprised if we saw a rethink on child benefit?
I'd be surprised if we saw a major U-turn on child benefit, but
you wouldn't call it a major U-turn. Would you be surprised if there was a change to that policy now?
We will always, with every policy, try and implement it in as sensible a way as possible, but I've heard nothing to suggest that we're about to change direction massively on child benefit. But the Prime Minister said he will be careful and thoughtful about how we do it and try and make changes as effectively and efficiently and fairly as possible.
Thank you both very much indeed. Thank you.